prostate cancer kind of comes in all shapes and sizes, and it really runs the gamut from very indolent forms of prostate cancer that we basically just monitor for people. And then there are other, what we call intermediate risk types, for which there's a number of treatment options available, either radiation therapy like Dr. Hall provides, surgery, and even monitoring for some people with intermediate risk cancer as well. And then, generally for higher risk cancers, we're talking about a combination of therapies, usually a mix of surgery, radiation, and hormonal treatments overall. So, without knowing a lot of the details, it's hard to make firm recommendations, but there's almost always a variety of options in each disease state, and that can be tailored to kind of a patient's kind of tolerance of risk, tolerance of side effects, things like that.
We have made some incredible advances in surgical options for prostate cancer with laparoscopic or robotic that Dr. Thomas can go into, and giving treatment with radiation in a week's time when it used to be 8 weeks. It is important for you to have a discussion about all your treatment options so that you know that you've been fully informed to make an educated decision about what's best for you. And I think that's what we want to drive home, is that prostate cancer requires a multidisciplinary approach. That's why the three of us are sitting here. There are various options for low, intermediate, and high-risk disease. And the combination of us together usually gets us to the best treatment program.
Oftentimes when we're seeing patients with advanced prostate cancer, we're talking about treatments to suppress the disease rather than to cure it, unfortunately. We are, though, getting to an era where particularly patients with cancer that has spread to just kind of one spot in the bone can be treated effectively with radiation therapy and actually cured in some situations. And so it's definitely an exciting new era in prostate cancer. In particular, we have kind of newer imaging to detect some of these bony, what we call metastases or sites of spread, and newer ways to administer treatment to those sites. So yes, unequivocally it can be treated, and now even sometimes cured for select patients.
We used to say metastatic, and there was just no way that we could control it, maybe for a little while, but ultimately we would not have successful treatment for what we call stage 4 prostate cancer, but that is just not what we're seeing these days. So we don't want someone to present with stage 4, and we've got a great screening test that catches prostate cancer very early, and we have excellent treatments for all stages of disease, but we are excited about the possibilities that we have for even advanced prostate cancer.